have begun wonderfully rich collaboration sessions with the delivery side, allowing them to understand what we're measured on, why we're measured on it, and compare that to what they're measured on, why they're measured on it, and find those synergy points where we can all sort of align.
Hello, welcome to Healthcare Collaborations, presented by Johns Hopkins Healthcare, a podcast all about redefining the value of health insurance through provider collaboration. In this episode, we welcome the Chief Medical Officer of Johns Hopkins Healthcare, Dr. Marketa Wills. Dr. Wills plays a critical role in the collaboration between payer and provider. With a clinical background, her healthcare management decisions are informed by her experiences on the delivery side. I asked Dr. Wills about this intersection and how it improves the relationship between JHHC and network providers. We also discuss the role health plans play in supporting integrated care in population health. And Dr. Wills goes in depth about the one area that she's always thinking about: quality. Good morning, Marketa. How are you today?
Good morning. How are you?
I'm doing well. Excited to have you, excited to have this conversation with you, learn a little bit about the work that you're doing here as being relatively new to JHHC as part of kind of a emerging new leadership team here for the organization, and learning about the work that you're doing and the future of our organization. You joined JHHC just several months ago. Where were you before then? What were you doing?
So I have been in the managed care space for approximately the last 10 years or so, give or take. I started my managed care career out at Optum Behavioral Health Solutions, which is a subsidiary of United Health Group. I then was recruited to WellCare Health Plans, which is a large national payer that primarily focused in the Medicaid and Medicare space. And then WellCare was acquired by Centene, which is another very large player in the Medicare Medicaid space on a national scale. And so that was my experience over the past 10 years of being at various national players in the managed care space prior to my coming to JHHC.
Yes, you talk about the managed care space. You also have a medical background in psychiatry. You still practice clinically a few hours a week, but you've broadened that career from practicing medicine to healthcare management. Can you talk about that intersection a little bit and why that appeals to you?
Sure thing. So to be honest with you, I never thought I'd do a residency in psychiatry. I always thought that I wanted to work right at the intersection of medicine and management, doing something similar to what I'm doing now as a chief medical officer. And psychiatry was kind of a happy detour. Life takes its twists and turns, and I ended up doing a psychiatric residency. Absolutely fell in love with that patient population. I did my first med school rotation at the VA and was working with veterans who were homeless, who had schizophrenia, lived with schizophrenia, who were hearing voices, and really got enamored with the idea of helping people with thought disorders live more stable lives, and became really into learning more and more about human behavior. And to be honest with you, even though that was a welcome detour, I do think that passion and interest in people and understanding people's stories, what motivates them, how they can grow, has not only served me well in a clinical capacity, but also shifts over into leadership skills in management as I've continued to grow as a leader in managed care. So I think it's a great synergy, both from a practicing physician perspective, as well as someone who's particularly interested in what makes people tick and how organizations can best leverage the skills and talents of individuals.
Yeah, and we'll talk a little bit about that later in terms of how that psychiatry influences what you do now. But I think it's also you mentioned how it affects your leadership. And I think it's important that in your position, you're able to maybe not lose sight of the behavioral health side of healthcare, where so much focus is on the physical health of the members and the patients that we serve, that maybe that influences a little bit and keeps that front and center with the organization's operations. Um, as you built up that experience on the business side of healthcare, what interested you about joining Johns Hopkins Healthcare specifically?
So specifically, it was really one thing, and it's the fact that it is a provider-led plan. From where I was sitting in managed care, it became exquisitely clear to me that the way that we were going to improve the health outcomes of populations, of our members, of our beneficiaries, was only if there were closer collaboration and partnership between the payment mechanism and the delivery side. And so having an opportunity to come to such a great institution that had already built that payer provider model was really, really compelling for me. I was really happy where I was, but the idea of being able to really innovate at scale in a provider-led plan is what pulled me over. I thought that was the best way to make an impact on communities, and that's something that I'm super passionate about.
Yeah, let's talk a little about that provider-sponsored health plan and payer-provider collaboration. Not unique to Johns Hopkins Healthcare and the health system. It is a relationship and a collaboration that does exist throughout the industry. However, with the world-class organization of Hopkins, there's part of the draw there and likely some of the strength in that collaboration. But what is something that you have learned, having worked on both sides of the healthcare industry, from the clinical and the business settings, that helps that collaboration and that partnership?
You know, one of the things that's so important is making sure that there are trust-based collaborative relationships. I think what I've learned is that everyone's goals align in terms of wanting to get the right care to the right individual at the right time to the most people. But sometimes there are competing priorities and perverse incentives that make it seem like we're not all on the same page when we look at different parts of the value chain in the healthcare ecosystem. And so one of the things that that's very clear to me is that we do want the same things. And once we begin to peel that first layer back and have those honest, open, trust-based relationships, we find ways where our incentives align, our goals align, and it's that kind of collaboration that brings that creativity. So you're looking on both sides, and then being at a world-class institution such as Hopkins, where you're also able to bring in the research and discovery and figure out how to deploy those things even faster to populations. It just is a great laboratory for how to think about advancing medicine as a whole. And I think the payment infrastructure is so important in that. And having folks who can talk both the clinical side as well as the business side is important in order to do that at scale.
Yeah, and it's still emerging in your capacity here with JHHC as CMO. But what have you been able to encounter with working with the health system side and our provider network that is the start of an effective partnership here so far?
Well, I think the fact that we all know that at the end of the day, any gains that are realized at JHHC ultimately go back into the larger JHM family. And so we get that we're all on the same page. And so being able to start in as, hey, comrades and colleagues that are marching towards the same goal allows for that more candid understanding of how we can all work together to drive health outcomes. I can't think of a better example of that than quality. We have begun wonderfully rich collaboration sessions with the delivery side, allowing them to understand what we're measured on, why we're measured on it, and compare that to what they're measured on, why they're measured on it, and find those synergy points where we can all sort of align. That happens with regards to information sharing. That happens, which is done in a very controlled way, but it happens in regards to financial decisions. And we're able to really think through at a system level, how can we get more of their patients, our members, the right level of care that they need while advancing the quality agenda. So just the trust, I think, allows us to really engage more fruitfully around creative solutions for improving the health of folks that live in Maryland and beyond.
And you mentioned quality, and that really is something that is critical to healthcare organizations like Johns Hopkins Healthcare and health systems. And it's something that I definitely want to unpack with you a little bit and get a little bit deeper on the work that JHHC is doing for quality, and just larger what the industry needs to do in order to focus on health outcomes for members and for patients. And you mentioned a little bit of that first layer seemingly being what we called in a previous episode, some healthy tension between payer and provider, that those financial incentives don't always seem to align on the surface, but really at the end goal, it's all about the improving the health outcomes, and more broadly than that, about community and population health. And with your proximity to that from the clinical and the healthcare management side, talk a little bit about population health and sort of the driving factors towards that, and how we're trying to move that.
Yeah, population health. It's a little bit of a buzzword these days, but I think there's some real substance and meat behind it, as opposed to those individual doctor-patient relationships that happen in the exam room. Population health asks us all as clinicians and scientists to step back and say, how do we deliver the best care to the biggest number of people in a standardized as possible way, recognizing that we'll need a tailored treatment to individual needs so that everybody's health outcomes lift, so that our populations are healthier. And so we can think about that along diagnostic categories. We can think about that along demographic categories such as age. We can think about that along state categories around the time of discharge planning. So there's a lot of different ways that we can think about in aggregate, how can we build processes and systems that ensure that those that we take care of, those who are assigned to us, are getting the maximal benefit from their interactions and experience within the healthcare setting. And that by no means undermines the individual relationships that patients have with their providers. In fact, it's what we got at before. It's why I'm here. It elevates that relationship between payer and provider. And so we want to be able to further support and edify that relationship in meaningful ways. And so that's what I think of when I think about population health. And I'm hoping to bring some of that philosophy into what we do here at Health Services at JHHC. More of that philosophy, I guess I should say.
Yeah, so looking at the health of populations is critical, but And this goes back to the point that you mentioned a little bit ago. There's work to be done in individualized care, right? So we're looking at the populations, but we don't want to lose sight of that individual and what their specific needs are and the entirety of that individual. With your background in psychiatry, you're passionate about integrated healthcare, which is treating the whole member. So what is integration to you? Why is that important? And what do you hope to do in that level of healthcare?
Yes, yes, yes. So, a couple things come to mind for me here. First and foremost, I think with all of us having gone through COVID, we all realize how critically important emotional and mental wellness is and how fragile it can be. And so, first and foremost, bringing that concept to the forefront um, and destigmatizing the treatment of behavioral health issues and making it something that's just as important as physical health. So that's number one, destigmatizing. But number two, recognizing that our brains are attached to our bodies, and there's so much interplay between physical health and behavioral health in terms of manifestation of symptoms. If you're stressed out, you may feel it in your belly. You may feel it as a headache. If you are getting treated for certain physical health conditions, the side effects of the medications may have behavioral health manifestations. Bottom line is physical health and behavioral health go hand in hand, and other pieces come into that as well, including social determinants of health, the systems in which people live, and their propensity to take medications as well. So when I think about integration, I think about whole person, member centric or patient centric health that takes into account the environment in which they live, as well as both mental health and physical health factors.
And again, that goes back also to the partnership with providers and how the payer can serve a role in that. Because some individuals, including those with multiple chronic conditions, are seeing several providers, maybe for behavioral health as well, in addition to, maybe diabetes or hypertension. And they have specialists, they have their PCP, they have their behavioral health providers that they're seeing. How do we ensure that that person's treatment is effective across the board? Obviously, providers have their full panels, and the payer, with that relationship as a provider sponsored health plan, can sort of step in and help and coordinate that care.
Such a great question. Such a great point. Making sure that I think that's one of the places where we as plans can successfully integrate into the broader healthcare delivery system with that help and care coordination and care management, making sure that we place the member at the center and help with some of that communication between specialists and PCPs and information sharing and all that good stuff. So I do think that is an important role that we play as payers of ensuring that integration happens, making sure that we're incenting that even financially, supporting innovative models such as patient-centered care homes, patient-centered medical homes, making sure that we are creating value-based arrangements that promote integrated care. We definitely play a role in ensuring that someone's physical health and mental health are thought through in a seamless, integrated way.
And as CMO, you have a front seat to another major aspect of the provider payer partnership, which is quality. And we talked about quality a little bit earlier. We touched on that. And just to bring it back, because it is such an all encompassing, it seems like at times, element of the work that payers are doing as well as providers. And it is a simple word, but it does tie in almost every aspect of the industry. And how much does quality and improving quality impact the work that you at JHHC are doing and your team is doing on a day-to-day basis?
Honestly, if I had to prioritize what it is that I think about all day, every day, And what keeps me up at night when I think about our members, it's quality. It's quality. It's making sure that not only are our members getting the right care at the right time in the right place that they deserve, but that is actually is driving towards improvements in health. And so measurement becomes a critical, important component of this, and monitoring and data, and making sure that we're able to take a look at a very granular level at whether or not our patients are receiving evidence-based care as they traverse the healthcare system, and using our data, leveraging our data to make decisions and design interventions to make sure that our members, who we are charged with taking care of, are receiving exactly what they need when they need it. So it impacts everything that we do. It impacts every decision we make. It impacts every process, every IT decision. Quality comes in, it's a ubiquitous piece. And I'm so delighted that we are in the process of really elevating the function of quality throughout JHHC as charged by our president and CEO, who recognizes that that's going to be what differentiates us as a plan, and also really understanding that at Johns Hopkins, quality is something that's got to be built into our DNA. And we have the resources to be able to study and understand at the university and medical school level what does create good outcomes. And then we can quickly translate that here at JHHC into innovations that impact the communities in which we live. So I'm really excited about our commitment to quality. And it's what I think about all day, every day.
Health plans are held to such strict quality standards between HEDIS and CAPS and STARS and value-based purchasing. You're being sort of measured and have all these requirements to hit, which exciting shouldn't be the word when you're held to such strict measurements, but it is exciting to be able to step back and think, okay, it really should all be about quality. We should be providing quality coverage. Providers should be providing quality care. Members should really be receiving the utmost quality in the industry. There are some domains that help influence quality and that we're looking at trying to ensure here. I don't know if you want to talk about like the effectiveness and efficiency and equity and some of those elements of quality that help kind of drive the work that you and JHHC are doing.
Absolutely, absolutely. And I think what you're referencing is the IHI, Institute for Healthcare Improvement Framework, that really, really talks about the various domains of quality. And we're trying to embed that thinking into what we do. So first of all, effectiveness, making sure that what's happening is actually making a difference. We're not just doing it just to be doing it. We're doing it because we want patients to live longer, because we want them to have less morbidity, less mortality, have better quality of life. So effectiveness is a good, important thing about quality. Efficiency is also important. Making sure that the systems and processes are operating smoothly and easily is an important piece of it. Equity is so important. We're hearing a lot now about healthcare disparities and wanting to make sure that we close racial and ethnic gaps, that we want to close all other gaps, and making sure that all of the populations that we serve have a shot at having positive health outcomes. Patient-centeredness. We talked about that earlier, how the patient has got to be at the center, that they really have to own their treatment plans. They're an integral part of their treatment plans. Long gone is that paternalistic view of medicine where the doctor tells the patient what to do. Now, what we're trying to do more and more is empower patients, empower members to have the information that they need to be integral parts of their treatment plan. safety, wanting to make sure that the things that we are doing, the treatment modalities that we are employing are safe, are not going to harm the patient, do no harm is an important concept, and that we build systems and structures and cultures that promote safety. We're not finger pointing at any one person who does anything wrong, but rather we're doing root cause analyses to step back and build cultures and processes that allow for safe outcomes 100% of the time. And then last but not least, timeliness. We want to be able to intervene when it's time, not too late, not too early. We want to be able to focus on preventive care. We want to be able to have good conversations about advanced care planning. And so making sure that we're meeting the member where they are at the right time in their lives. And one of the things that we use to sort of bring all these various domains together, and we talked about it earlier, but it's true, is data. Data to be able to look and understand our population and be able to make timely interventions when we need to ensure that we are supporting our populations the way that they need to be supported for healthier outcomes.
And we started by talking about provider-sponsored health plans at the beginning of this year and that relationship. And let's kind of bring it full circle here, because one of the ways that health plans are pursuing quality is moving from a fee-for-service relationship in contract to value-based care contracts. Can you talk about what that is a little bit, that distinction, and why that's important, kind of, and how that operates in action?
Yes, I can. Yes, I can. And I just have to say, I was in medical school in the late 90s, graduated from medical school in 2000. And the concept of value-based care was just getting steam. We were just starting to talk about 20 years ago, 25 years ago, how to pay and incent on value as opposed to on widgets, on procedures, on use of care, utilization. And I am so happy to say that I've been in the field long enough to now see, oh, wow, we're starting to really, really build out those concepts. And we are, for example, in the Medicaid plan in the state of Maryland, because of the strength of the measurement of quality, are able to say, now we are going to pay based on making sure that these things happen, not based on the number of visits, not based on the amount of time that they've come, but based on the fact that what we know is evidence-based standard of care is happening. Also, based on outcomes, based on making sure that we have controlled the blood pressure or we have stabilized the hemoglobin A1C. So no longer is it important to just draw that lab value or take that blood pressure, but it's more and more important to pay our provider partners based on their ability to impact health outcomes. And that's really what that value-based contracting and value-based purchasing is all about. It's tricky because you've got to translate the science into the, all the way over here, the dollars. And going through that is, claims and making sure that you've got the right infrastructure, making sure that you've got the right incentives. And so it requires a multi-pronged, multidisciplinary approach to really be able to execute on that. But at the end of the day, it's one of the tools that we have to really align incentives so that payers and providers are working towards the same thing. And there's not that perverse incentive for just paying for widgets, if you will. So it's really neat to be a part of that growth that change from when it was a concept to now, here we are executing that and being evaluated on that and innovating on that. And that's an exciting part of being in a place like JHHC.
The interesting thing about that is it really ties in all the ground that we covered. Population health, we're looking at the health outcomes, the integration, looking at member-centered care and treating the whole member, quality, and that collaboration between payer and provider. And we've covered a lot of important ground. You've provided some phenomenal insights and context here. Are there any final words that you'd like to share before we wrap here? Is there anything else that you'd like to mention?
Yeah, I mean, it's a little hokey, but it's really true. It is truly, my honor and privilege to wake up every day and think about this in the midst of incredibly brilliant, talented colleagues at Johns Hopkins. And it's just amazing to see where we're headed as an organization under JP's leadership. I just think that JHHC has such a bright future ahead. And I am super excited, super honored to be part of the transformation and journey that we're having as we work really, really hard to improve the health of the communities that we serve across our 4 lines of business: Medicare, Medicaid, USFHP, and also EHP. And every email, every interaction, every meeting, I am excited and jazzed about what it is that we get to do. And it feels good being able to go to sleep at night knowing that we're on the right side of making big impact, not only for our members, but for healthcare in general. So thank you for this opportunity.
I want to thank Dr. Wills for taking time out of her super busy schedule to join us for that conversation. We want to highlight, celebrate, and enhance payer-provider collaboration. I mean, it's the name of this podcast. And Dr. Wills' role as CMO sits right at the heart of that partnership and the decisions that directly impact quality health outcomes. I'm glad we got a peek at that process and the factors that drive it. If you'd like to continue this conversation, we developed a companion article to this episode. Click the link in the description to read it. Another critical aspect of payer-provider collaboration is sharing data and information, much of it personal. It's necessary to ensure effective care, but it needs to be protected. In our next episode, we visit with Dan Dunkers, Vice President of Information Technology at JHHC. He talks about the importance of securing private health information and some of the methods that have JHHC on the leading edge of information security in a rapidly evolving digital landscape.
Digital transformation in healthcare is really driven by the need to provide improved and tailored healthcare to members when and where they want it.
Join us next month for that discussion on data and information sharing.